Good evening and thank you for joining us. A Windsor woman is speaking out after her mother, a current patient at Hotel Dieu Grace Healthcare, had to decide whether to move to a long-term care home or pay hundreds of dollars to stay in the hospital. Her daughter says the long-term care home they wanted her to move to was unacceptable, and now she's refusing to pay. CTV's Sanjay Moore joins me to explain now. Sanjay, what exactly is going on?
Well, this is all to do with Bill 7, provincial legislation aimed at freeing up hospital bed capacity. Essentially, if a patient is considered to no longer require hospital care, the hospital can move that patient without their consent to a long-term care home of the hospital's choosing. And for a patient to refuse this move can result in a $400 a day penalty. And for one patient at this hospital, that bill is racking up fast. Ruth Poupard is a patient at Hotel Dieu Grace Healthcare. A few weeks ago, she was ready to be released to a long-term care home, but there were no beds available at any of her daughter's top choices. Instead, Michele Campeau, who serves as her mother's power of attorney for healthcare, says she was presented with a completely different choice by the hospital.
They gave me 24 hours to look at the facility, and it was just unacceptable.
Campeau says when she stepped inside, the hallways were cluttered, the entrance was unsecure, and it was dirty. Faced with a decision, move her mother to that care home or pay $400 a day to remain in hospital, Campeau chose neither option, refusing to pay more than she would in long-term care.
What we think would be fair is just charge us what she would be paying in a nursing home until one becomes available.
That cost, according to Campeau, should be around $2,000 a month through a government copay.
Well, the $400 fee was introduced by the province to create a way for hospitals to recover costs because we're occupying a bed with a patient that shouldn't be there, frankly.
Hotel Dieu Grace Healthcare CEO Bill Mara says there are 45 patients in Windsor-Essex who have been admitted to the hospital but are waiting for a bed. Mara would not speak to this case in particular, but did say the goal behind Bill 7 is to get people a hospital bed who desperately need one.
I understand where a family might be coming from if they're worried about putting mom or dad or a loved one in a bed and then having to move them again to their preferred location. That's very disruptive. But unfortunately, that's one of the outcomes of what we're facing right now with the stress on the hospital bed system.
But Campeau says her mother has dementia, so moving her to one long-term care home, then moving her again when another facility opens up is not a fair solution. Campeau adds she plans on retaining a lawyer to fight paying the $400 a day fee. And I also asked the CEO here at Hotel Dieu Grace Healthcare about Campeau's claim that the long-term care home which this hospital selected for her mother to move had conditions which were, quote, unacceptable. But Bill Mara simply tells me all long-term care homes in Ontario must adhere to the same regulatory standards.